Welcome to Aegify's webinar titled HIPAA Omnibus Demystified Implications for Healthcare Providers and Business Associates. Today's presenter is Anupam Sahai, co-founder and president, Aegify Inc. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products generating up to hundreds of millions of dollars annually. Prior to Aegify, Anupam was Vice President, Marketing for Ixia Inc. He is a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, networking, and is a featured speaker at several industry conferences worldwide. We want to tailor this webinar and our future webinars to suit our audience, so we'll ask some demographic questions in the form of a poll. And I will launch the first poll question now. What is your current status? And the options here, what is your current status? The options are covered entity, business associate, service provider, or other. And I invite all the attendees to vote in the polls area of GoToWebinar. And I will close the poll in 5 seconds here. Okay. So the question was, what is your current status? 39% of you are covered entities, 29% service providers, and 23% business associates. Our second poll question, what is your position? And the options here are executive, compliance-related, risk privacy related, IT related, and other. Go ahead and vote, and I'll close the poll in 5 seconds. Okay, and the results of what is your position? 31% for both IT related and compliance related, with 18% executive and 11% risk privacy related. Okay, have you undergone, our third question, have you undergone a security risk analysis? Simply answer yes or no. Have you undergone a security risk analysis? And this is our last poll question. I'll close the poll in 5 seconds. Okay, the results of have you undergone a security risk analysis. The results are 64% yes, 36% no. All right, thank you all for participating in this poll. If you have any questions, please send them via the questions function in GoToWebinar, and we will address them at the end of the presentation. Anupam's email address is there on the screen. If you have any, or if you'd like a copy of the presentation, please send an email directly to Anupam at anupam.sahai@aegify.com, and he will get back to you with the slides. Thank you, Anupam, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon, everybody. So the topic that I'll cover today, I'll start off by talking about HIPAA Omnibus and summarize the changes that have taken place and how it impacts covered entities and business associates and subcontractors that are working closely with Cs and BAs. Then I'll talk about 9 steps to prepare for an OCR audit at a high-level guidance with respect to what should organizations do to prepare themselves for an audit, and how to deal with it in case you do get summons to be audited. What should the business do to deal with it? And then I'll at the end talk about Aegify, which is an automated cloud-based subscription service that will help you manage your end-to-end security and compliance issues. And at the end, we'll have a Q&A. So as you can see, there's a lot of topics to cover, and I'll try my best to go through them during the course of the presentation today. If there's specific areas that you would like us to talk more about, feel free to reach out to me via email. Before we start, I want to just give out some standard disclaimers that HIPAA HITECH is a continuously evolving subject and is subject to multiple interpretations. So while we've taken a lot of care to ensure the information is up to date and accurate, we are not the legal counsel, so I would advise you to not construe this as legal advice. So before I start, let me put some vocabulary and define some acronyms that I'm going to be using through the call and through the webinar. So HHS stands for Health and Human Services, and OCR is the Office of Civil Rights, which is the enforcement agency which is part of HHS. PHI and EPHI, I'll use the terms interchangeably sometimes, stands for Protected Health Information or its electronic version, and I'll define what PHI construes and what it is comprised of. And CE stands for Covered Entity, BA stands for Business Associate. And some of the definitions of covered entity and BAs have changed as a result of the recent HIPAA Omnibus rule, and I'll discuss that as well. So the framework of HIPAA HITECH, the HIPAA rule was enacted in 1996. HITECH was enacted as part of the American Recovery Act in 2009, and the HIPAA Omnibus rule essentially was put into place in January of 2013. And as you'll see, there's a progression and finer refinement of the HIPAA rules starting from 1996 and 2009 and 2013. Sorry about that. And when we talk about HIPAA HITECH rules, we're going to be focused on really three aspects of it: privacy, security, enforcement, and HITECH. And while the other components and other parts of HIPAA HITECH, that's not really going to be affecting our discussion today. So let's start with the definition of PHI. And if you look at HIPAA HITECH, the higher objective of HIPAA HITECH is to enable and facilitate sharing of healthcare information so that multiple providers can exchange patient information and be able to bring down the cost of healthcare administration. Now, a side effect of that objective is that healthcare information needs to be shared beyond the physical premises of a doctor or a service provider. And that requires protection, and that makes PHI, the protected health information, which comprises of personal information and health information, it makes PHI accessible over the internet and thereby prone to breaches or privacy and security violations. So the whole HIPAA HITECH, one of the set of requirements of HIPAA HITECH that it's trying to protect is to ensure privacy and security of PHI. And hence the definition of PHI becomes critical. And so PHI is defined to be any information in electronic or physical form that pertains to an individual, either, oops, sorry about that. Okay. So PHI pertains to health information or personal information. Personal information could be name, address, birth date, social security number. Health information could be physical or mental health condition. And any information that can be tracked back to an individual is construed to be PHI that needs to be protected. The definition of a covered entity is a combination of a healthcare provider or a health plan or a healthcare clearinghouse. So a healthcare provider could be doctors, clinics, psychologists, the list there. A health plan could be a health insurance company, a HMO, and similarly a healthcare clearinghouse could be an exchange or a clearinghouse that deals with multiple information sources to exchange and make sharing of information possible. So let's jump right into it. So what does HIPAA Omnibus bring about? So one of the key things that HIPAA Omnibus does is to validate and make the HITECH law changes that were enacted in 2009 be part of HIPAA. And it essentially HITECH enables HIPAA with some modifications, and I'll talk about what those modifications are. And so it affects the core tenets of HIPAA, which are privacy rule, the security rule, the breach notification rule, and the enforcement rule. And so how does it affect it? So one of the key changes is the definition of what is construed to be a business associate. Now, business associates are directly liable along with subcontractors and the covered entities to ensure that they're following the HIPAA HITECH requirements. And there are new guidance with respect to how the PHI information can be disclosed for any kind of marketing and fundraising purposes, period. So individuals will now have the right to receive copies of their health information, and they will need to be kept in the loop to ensure that if any information is shared externally, they need to approve that sharing. So this requires changes and modifications to the current notice of privacy practices that individuals whose PHI information is being handled by the covered entity, they need to be able to be aware of what information is being shared by whom and need to approve it specifically. And of course, the HITECH Act had brought about certain guidance with respect to how breaches need to be dealt with, how enforcement needs to happen. That will also need to be implemented. And I'll cover that as we go forward in the presentation. So I talked about the definition of business associate. Another key aspect that comes from the HITECH rule is that not only covered entities, but any business associate and their subcontractors are as liable and share the responsibility with covered entities to ensure privacy and security of the PHI information. And if a breach happens, or if there is reporting of willful neglect, HHS is now required to launch a formal investigation to ensure that they take action for any reported breaches. HITECH had introduced the tiered civil penalty structure, civil money penalty structure, based on the degrees of neglect. So if you are doing a willful neglect, which is defined to be a conscious, intentional failure or reckless indifference to not following the law, that is the highest penalty tier. And HHS can now impose penalties of up to $1.5 million per violation with no upper limit. So per incident could be $1.5 million per violation, and that is at the tier of willful neglect. And there's potential criminal prosecution ability for violating or doing willful neglect of certain requirements for privacy and security. There's also change in the breach notification rule, where now by default businesses need to report it to HHS in case a breach happens. Earlier that was a little gray, and I'll talk about what exactly it means and how it affects the current group of covered entities and business associates. And all of this needs to be in implementation by September 23rd, 2013. So we are a few months away from the implementation dates, and the enforcement is supposed to start after that. So given the new scope of business associate, now what is a business associate? What it basically comes down to is that excuse me, anybody in the healthcare community who has access to PHI in physical or electronic form have the same responsibility and liability as the covered entities that they work with. And there's a liability chain that goes from covered entities to business associates to subcontractors who are anybody who's touching PHI. They're bound by the same regulations of HIPAA HITECH. And so who's a business associate? It's probably either or a combination of any of these and more. It could be a lawyer, it could be an accountant, it could be an MSP, it could be an internet service provider, It could be a garbage collector who is responsible for disposing of PHI in physical form or electronic form. So anybody and everybody who touches PHI, and there are about 2 million plus business associates in the US today, and there are about 700,000 roughly medical providers, covered entities, that are in the scope of the law as per the HIPAA HITECH latest regulation. So let me try to summarize the privacy requirement as a result of HIPAA Omnibus and HIPAA HITECH. It essentially expands the rights, individual rights to access the information, to restrict disclosures, and to ensure that they only share the information when they want to, and if there's any marketing or fundraising happening with the PHI information, they need to be in the loop, individuals need to be in the loop and approve it. And so there's no sale or marketing or fundraising of PHI without patient authorization, period. From a security rule perspective, it basically adds more clarification to the 4 sub-clauses of the security rule, which deal with admin procedures, physical safeguards, security services, and security mechanisms that are required to protect and secure PHI. And this rule is now not only applicable to covered entities, which was the case earlier, but it's also applicable to business associates and their subcontractors in the same vein. From a security requirements point of view, PHI needs to be secured, period. Whether it's at rest, whether it's in transit, whether it's sitting on a fax machine, servers, backup media, or it's being sent via email, all of this needs to be secure. It cannot be, you cannot send out patient information at email in clear form, and this is true not just for covered entities, but for BAs and subcontractors. The whole value chain, whole liability chain needs to follow the guidelines. So having established the background, now let's try to understand how does it change the scope of things with respect to a covered entity and a business associate. What do they need to do differently? So from a covered entity perspective, the number of significant changes that come about. One is that they need to revise the privacy policies, which means that any use of PHI information that is used for fundraising or marketing now needs to be authorized specifically by the individual. And individuals need to be brought in the loop to ensure that any PHI that's available electronically, that they have access to that as well, so that they know what's available, what is potentially the exposure. Secondly, the privacy practices notices, they need to be amended to ensure that patients are able to authorize disclosure of PHI information for marketing or fundraising purposes. And anything and everything that's shared or accessible by anybody else, the individuals need to know about it. And if, for whatever reason, if there's a breach that happens, individuals need to be notified of that. So that's the big change that impacts the privacy notices. There's also change required now to the business associate agreements, which is also called BAA. And now a business associate agreement needs to be put in place with any business associate and subcontractors to ensure that they are taking precautions and making sure that they are also becoming secure, dealing with security and privacy of PHI information by following the HIPAA HITECH regulation. And so the business associate agreement needs to put that to paper. They need to ensure that every business associate is compliant with HIPAA HITECH, and they are putting together breach notification guidance. So if there's a breach that happens in a BA or in a subcontractor location, the covered entity needs to be reported to within 60 days, for example, of any breach, so that they can in turn report it to HHS. So all of this needs to be put in the business associate agreement. And The other change is the need to change the security breach incident response plan. So if there's a breach that happens, the default action is to report it, unless it can be proven through a risk assessment that there is a low probability of any compromise, which is an involved process. So the default behavior should be inform the HHS and then do the due diligence to minimize the damage or to scope out the damage that might have been caused by this breach. And the risk assessment typically involves doing a security risk analysis to understand who broke in, what information was compromised, and all of this needs to be documented. But the bottom line is it needs to be reported to HHS first before you do the justification for that the damage was low so that the penalties, etc., could be minimized. And the final change from a covered entity perspective is the training requirement. All the changes to the privacy, security, the business associate agreement that we talked about now needs to be communicated, and the internal workforce members need to be trained to ensure that they're dealing with the privacy and security related requirements and how PHI needs to be handled in a cohesive manner, in a manner that's compatible with the HIPAA HITECH guidance. So it's very important. So all of this is good because at the end of the day, you're trying to minimize the risk of exposure from a covered entity perspective by ensuring privacy and security of PHI information. So now let's jump into the business associate side. So what are the changes if you are a business associate or a subcontractor who's working with a business associate or the covered entity? And there are a number of significant changes as well. So first thing is, just like the covered entity, the privacy policy needs to be followed. And this is going to be laid out in the business associate agreement that you're going to be entering into with the covered entity or with a business associate if you're a subcontractor. And so there are responsibilities for breach notification, for privacy and security of PHI information, and you need to make sure that any information that you publish about the individual needs to be reported back to the covered entity and to the individual. So all of this is part of the new requirement and the guidance from HHS on HIPAA HITECH. And it also means that only the necessary information needs to be disclosed and not anything more than what's required. Otherwise, it's considered to be misuse. And then training of all workforce members and agents about the privacy requirement and the security requirements becomes key. From a security perspective, the complete security guidelines from a HIPAA HITECH perspective needs to be implemented now in a BA as well. And they are required to be implementing the administrative safeguards, the physical safeguards, the technical safeguards, and the technical mechanisms, which are the cornerstones of the security policy in HIPAA HITECH, is required to be implemented by BAs and subcontractors. It also involves changing the breach incident response policy, wherein BAs and subcontractors need to report back to covered entity within 60 days if there is a breach that happens. And covered entities would then inform HHS and also inform individuals involved to ensure that they're following the law. So in summary, there are a number of game changers in HIPAA Omnibus that was also discussed partially in HITECH, and this is basically a summary of all the changes. So periodic audits can and will be done by HHS and OCR as part of the new regulation. And I'll talk about some of the audits that happened last year, what was validated there, and what's the plan going forward. But now the audits will affect BAs and subcontractors as well. I talked about the fines going up. Earlier in HIPAA, it was something like $100, so people didn't bother much about, frankly, to follow the law. Sometimes they said, okay, we get fined, so be it. but now the fines have gone up dramatically. And I talked about $1.5 million per incident category. And there are new criminal liabilities that go along with it. So there's no maximum fine. And there are new provisions in the law which allows the enforcement agency to basically use that as a funding opportunity to fund the activities of enforcement. And not only that, there's a whistleblower clause which also shares the proceeds of the fines or enforcement results with the whistleblower in case there's a disgruntled employee or an external observer or an individual whose information got compromised. They can report to HHS and thereby bring about them to do an audit or impose fines. And not only the OCR can do audits and civil actions, but state auditor generals can act on behalf of the enforcement agency to bring about action or penalties or civil actions on behalf of the individuals. I talked about the liability chain now includes not just the covered entity, but BAs and subcontractors who are now required by law to follow HIPAA HITECH guidelines for security and compliance. And the data breach notification requirements have changed. So as you can see here, there are a lot of details that I've covered so far, but the number of game changers that have really upped the fine structure, up the incentive for the government to ensure security and compliance of the PHI information and the HIPAA HITECH law. And as PHI information becomes electronic, as patient information becomes electronic, breaches have really gone up, and that brings about the need to really put some concerted effort to ensure privacy and security of data. So while sharing is good, but there are bad guys out there, and HIPAA HITECH is trying to put together some best practices to ensure privacy and security of PHI information. So in the end, the customer wins, but there's going to be some process that businesses need to go through to get there. So as I mentioned earlier, there are about 700,000 covered entities, roughly about 2+ million BAs that need to be HIPAA HITECH compliant. Now, while all these penalties and everything is good, the government has also put together some incentive money to ensure that people follow the law. So there's $28 billion worth of stimulus money kept aside by government to accelerate the adoption of electronic medical records. And depending on whether you're a Medicare or a Medicaid provider, you can get different amounts. And in order to get this amount, money reimbursed from the government for implementing electronic medical records, you need to show that you've done HIPAA HITECH compliance, and you need to do a risk analysis to ensure that you're protecting PHI information. So there's a carrot and stick approach taken by the government, which overall benefits the consumer. So the question that we often get asked is that, do we really need to worry about it? I mean, how pervasive are breaches? So breaches are actually much more frequent than you think, and I'll show you some statistics that it affects not only small businesses, but large organizations and even governments. There were recent breach reports of defense secrets being stolen. So no government entity is safe against attackers, and that's because the attackers are very sophisticated. They have a great organization and much more sophisticated tools. So from a business perspective, PHI information breaches are pretty widespread, and it's affecting state level organizations like Alaska and Utah, and the breach tally is huge. There are about 21.7 million records that were compromised as of March 2013, resulting from 600 breaches that took place, and this is for more than 500 individual records at a time. And if you take the less than 500 record breaches, the tally would be approximately double the amount. So it's a huge problem. And this is the official reporting from the HHS website based on the reports that are required by covered entities and BAs now. So there are roughly about 800 to 900 breaches that are happening on a monthly basis. This column tells you the number of breaches that are reported every month. And roughly about 24 to 25% of the breaches are actionable, and they basically get followed up, either fined or corrections, etc. So it's a huge problem. You can also see the latest tally of breaches by going to the HHS website, which is also called the Wall of Shame. And it's called Wall of Shame because it's got all kinds of breach reports. And the names are put up there. And you'll find that businesses of all sizes are showing up there. There are business associates that are involved, and roughly about 50% of the breaches are due to business associates. So it's a shared liability, and HIPAA Omnibus pretty much puts to law what has been well known, that not only covered entities but business associates need to do their bit to ensure privacy and security of PHI information. So now let's jump into the HIPAA audits, and what does the OCR look for when they are kind of going into an organization and looking into auditing them. So no surprise here that they're looking into the privacy, security, and the breach rules, which are part and parcel of HIPAA HITECH, and they want to make sure that the organization has put together the policies, procedures, and the mechanisms to ensure privacy and security of PHI information. And this was published by HHS for the audits that were done last year. And there were about 125 organizations that were randomly selected in 2012 for an audit. And it is rumored that in October of this year, when the new fiscal year starts, there will be a permanent HIPAA HITECH audit program that will be launched, similar to what IRS does to pick some percentage of organizations to do a random audit. So they're going to be looking at HIPAA HITECH and privacy security, breach notification related rule implementation issues there. So what can you do as an organization to be prepared? And what can you do to make sure that as an organization you're ready to face an audit? So first thing is to understand what does it mean to follow the law? What does HIPAA HITECH entail? How to go about doing and meeting the requirements of HIPAA HITECH? And then, of course, making sure that there is a need to put together a security and compliance plan which will protect PHI information and implement the privacy and security requirements that come from HIPAA HITECH. And that involves assigning roles, training employees about what are the best practices, what should be done, what should not be done, do's and don'ts. And then start off by doing a self-assessment, which means that you need to understand where does the business stand today vis-a-vis the HIPAA HITECH requirements, and what are the gaps, and what's the risk level associated with the gaps that are found. And that is done using a vulnerability management of all the assets that you have. So you might have PHI information sitting on a fax machine or on a server somewhere or in the cloud. What is the probability or what's the vulnerability of those PHI, of that PHI information? And if somebody breaks in, can they access that information and compromise it? And so you need to do a security risk analysis to ensure that the gaps that are found and the vulnerabilities that are found are not exploitable, or they are within a certain limit of acceptability. And then you basically go about implementing the safeguards and controls and the breach notification plan to ensure that the privacy and security requirements are implemented and followed in the organization. And just as you reward employees, you need to put together some kind of policies and procedures to ensure safeguarding of information, put accountability in place to ensure that the roles are taking steps to deal with the requirements. And then at any point in time, you need to have a proof of compliance, which essentially comes down to having documentation of all the policies, procedures, and the privacy and security related steps that you've taken to ensure compliance. And that is typically in the form of a document, which is attestation of compliance, to show somebody walking in that you've done the pre-work required to meet the HIPAA HITECH requirements, so that there's no willful neglect that shows up knocking on the door. So these are the 9 steps that need to be repeated so that you are on top of the requirement. And as I always say, security and compliance is a journey, and it needs to be we need to start somewhere, but needs to be maintained on a regular basis, maybe every quarter, every 6 months, annually at least, and that's the excuse me, bottom line. Now, once you're prepared and you still get some requests for an audit, essentially you need to provide all the steps that you've taken, policy documents, all the breach plan reporting documentation, training methods, and all the security methods that you've taken and implemented, and provide that as proof to OCR, along with any specific requirements that they might have made in the reach out that they typically do before they start auditing. So you need to have a report on compliance or attestation of compliance that shows the steps and the policy and procedures that you've implemented in-house to train and maintain privacy and security of PHI information. So that's the high-level requirements, and looks like a lot of things, a lot of moving parts. But I want to talk about some an automated solution that makes your life simple. And today, typically, all of this is done manually, either by auditors who walk in the door and pretty much do the assessment in a very labor-intensive way. It causes a lot of time, resources, and money. And I'll talk about Aegify, which is a cloud-based subscription service that automates this whole process of HIPAA HITECH compliance and regulation. It's a subscription service that supports certainly HIPAA HITECH, but other compliance frameworks. And it also does vulnerability scanning and can generate a simple report on compliance that will document all the steps that you need to understand what has been done in the organization and to follow the recommendations to plug the gaps that are found. It comes built in with best practices and policy and procedure templates that you can use to customize it to your needs and then implement it as proof of compliance, so that you are pretty much enabled by the tool to automate the whole process, including best practices and training requirements. The workflow supported by the tool is by Aegify is, as I talked about earlier, doing an initial assessment with a security scan to understand the vulnerabilities. And then once you get the gap report with risk associated with the gaps, you can then put together a plan to plug the gaps through a remediation plan, which might include putting together new policies, new training practices, maybe adding new devices in the network, or to change some default passwords. All of that will be provided in terms of a guidance by the tool. And then you go back and reevaluate your assessment once you've done the remediation using the tool. So you can repeat this process anytime. It'll give you a real-time security and compliance posture for your organization that I'll show you, and you get a pretty ready view of where you stand as an organization in a matter of minutes. And of course, there are different versions of the tool depending on the business size. There's a module to deal with vendor and BA management as well, so the requirement coming from HIPAA Omnibus can also be automated. If you're a covered entity or if you're a BA, you can use the tool to manage your internal security and compliance requirements, but also you can also work with your subcontractors or BAs to manage their security and compliance posture, and thereby have complete visibility into what's going on and how your PHI information is moving through the system, as it were. The product scales up from small doctor offices all the way to large hospitals. As I said, multiple editions serve that need. Now let me show you some screenshots of the tool so that you get a glimpse of what the automation capability looks like. So when you log in, you get a dashboard which gives you your security posture and compliance posture. And this is a result of the security scan that is done by a piece of software that's sitting on your premises. And this piece of software essentially is scanning the network, discovering all the assets that are relevant, and will tell you the vulnerabilities and assets that are found and how it affects your compliance posture. And by the way, there's a diagnostic version of the tool available for free subscription from egistol.com that you can download free of charge. You can run the tool, and in a matter of minutes, it will tell you where do you stand today with respect to your security and compliance posture. Every organization needs to go through an assessment process which involves answering yes and no questions. The security scan that I talked about earlier will automatically answer some of these assessments based on the assets that are in the network, depending on hardware, mobile devices, PC, servers, etc. It'll auto-answer some of the questions. For the rest, you need to answer yes and no questions. And it will provide, you can also upload evidence for answering yes and no. And if you need help in answering some of these questions, there are inline policy documents that you can use and customize to your needs. And there are, for example, business associate agreements that are available that as a covered entity you can use this template, customize it, and adopt it to your needs. The tool also provides a knowledge base on the right-hand side, which gives you complete guidance with respect to how to interpret the questions and also how to answer yes to certain questions and no to certain questions. So it will give you the best practices in the industry. This is derived from NIST and other authoritative sources, which essentially defines what should an organization do to answer yes to a particular question. And it will also provide you with risk level parameters so that you know whether a certain question is and its relative importance with respect to the other questions in the. So it provides you with complete guidance. It will also give you, after the scan, it will give you the vulnerability view, which will tell you the top 10 vulnerabilities that exist in your business assets, in your PCs, hardwares, services that are running. It will also tell you the relative ranking and the trend line that might change with time as you fix problems. And not only that, it will tell you the problems that are found, but it will also give you guidance with respect to how to go about fixing the problems that are found. So it's again telling you the issues, the problems that are found, will guide you through the remediation process. If there's software patches missing or configuration issues, maybe there's some default passwords that you haven't changed, it will identify those problems and guide you through it. So it's a complete compliance and security management tool. At the end of the whole process or during the assessment process, you can generate a report on compliance, which is essentially an attestation of compliance proof, which will tell you where do you stand as an organization, either before you're audited or once you've gone through the remediation. It will stand as a document to prove where do you stand as an organization with respect to your security and compliance posture. And if you have a number of BAs that you work with, you can also use the tool to get a snapshot of the risk rating of the BAs. So if I'm a covered entity and I want to make sure that all my BAs and subcontractors that I work with are following the law, that they're not causing an increased risk exposure or increased liability for me as a covered entity with respect to handling of PHI information. So I can use the tool to get a snapshot of the security and compliance posture of all my BAs. In this case, diagnosis center, labs, or any accountant or lawyers are BAs that I need to know with respect to what the current security and compliance posture is. And the report will also tell me what my compliance level is, what's the risk exposure, and then it'll also provide you with certain email templates that you can use to work with the BAs to ensure that they are aware of the law And covered entities now, because of HIPAA Omnibus, have a lot more leverage to ensure that they are not only putting together a business associate agreement with their BAs, but also enforcing HIPAA HITECH related privacy and security requirements that every BA is compliant with HIPAA HITECH now. So you can nudge your BAs with some kind of a letter, informing them, educating them, and also making sure that they are following the law. So in summary, as a covered entity or as a business associate, it's very important to know where do you stand today. How far are you from meeting the HIPAA HITECH requirements? So doing a self-assessment and putting together a security and compliance plan, assigning resources to deal with the problem, and then making sure, more importantly, that you're protecting and ensuring the privacy and security of PHI information. And lastly, if for whatever reason you get breached or data gets compromised, there needs to be a breach response plan in place. So these are the important aspects that any organization needs to do to ensure that they are taking steps to deal with the HIPAA HITECH related issues. So in summary, in closing, Aegify will help you automate your security and compliance issues. You can generate a report on compliance, or you can do risk analysis to deal with the meaningful use requirements for getting the federal money that I talked about earlier. You can also use it to manage your BAs and subcontractors, which is required by HIPAA Omnibus. And essentially it completely automates your security and compliance needs using a cloud-based subscription service. And currently, Aegify is sold through a set of channel partners who resell our service. So if your service provider does not support Aegify, we would be interested in talking to them, and please let us know if you have any questions. So with that, I'll turn it over to Mike for Q&A. Mike, you there?
Okay, great. Thanks. Yep, I am here. Thank you, Nupam, for presenting. To the attendees, if you have any questions, feel free to ask them in the questions area or the chat area, and we'll get them answered. Just a reminder, Nupam, can you put up your slide that has your contact information so everyone knows how to reach out to you? If you would like a copy of the slides, I got some requests in our questions area. If you'd like a copy of the slides, feel free to email Anupam at anupam.sahai@egestalt.com. And we've also recorded this webinar, and we'll have the recording up on Egestalt's website in the next day or so. Okay, so here's our first question. Does the CE require a BA agreement with the BA subcontractors?
If the BA subcontractor is working directly with the BA and not with the CE, then it's the responsibility of the business associate to put that agreement in place. But if the BA subcontractor is working with the covered entity as well, then yes, the BA agreement needs to be done with the subcontractor as well. So it really depends on where is the subcontractor attached to, either the CE or the BA, and the responsibility is to that entity.
Okay, great. Thank you, Nupam. As far as the whistleblower goes, is there a percentage the whistleblower receives? Do we know how the proceeds may be shared?
I do not have that information. I can dig it up, but I don't believe there is a fixed percentage, because it's really going to be a part of the fines that are levied, and the proceeds will be shared based on that. But I do not have a number in my head right now. I can find out.
To Anupam by email, and then that'll allow Anupam to ask some clarifying questions, and then you can get your question answered.
Sure.
All right, ROC is an acronym. What is that acronym for, ROC?
Oh, I'm sorry, I should have mentioned that. So ROC stands for Report on Compliance, and that's a report that documents all the steps that have been taken by the business to ensure compliance and security-related practices. So it includes all the HIPAA HITECH related controls, and which includes privacy, security-related issues, and the steps are documented in the report on compliance. So it serves as a proof of compliance for an auditor. If they walk in the door, it'll essentially communicate in one report what was done.
Okay, great. Thank you, Anupam. We do have a lot more questions, but we're running out of time. So what we'll do is Anupam will get all the questions from GoToWebinar, and he will reply to them by email. And again, if you have any questions after this webinar, feel free to email or call Anupam at the email address and phone number above. Okay, thank you to the attendees. As a reminder, we've recorded this webinar, and it'll be available on www.egestalt.com within the next day or so. Thank you to the attendees for coming. Thank you, Anupam, for presenting. I'll leave the last word with you, Anupam.
Yeah, so I would like to thank everybody for coming. This is a pretty complex topic, so I would love to get your feedback on what are the issues that you would like me to talk more about, or some things that were not clear. Please feel free to reach out to me, and I'll be happy to answer any questions that you might have. Thank you for coming again, and good afternoon. And good morning.
Great. Thank you, attendees, and have a great day. Bye-bye.
Have a great day. Bye.